Exclusive. Crisis at Royal Prince Alfred Hospital. HIV patients left vulnerable amid staff exodus. The Royal Prince Alfred Hospital, RPA, in Sydney is facing a critical staffing crisis, leaving vulnerable HIV patients without adequate mental health support, according to explosive revelations from former staff members. This alarming situation underscores a broader systemic failure within the NSW public health system, leaving a significant portion of the HIV-positive population at risk. The Guardian Australia has uncovered disturbing details painting a picture of neglect and inadequate care. Former RPA psychiatrist, Dr. Susanna Goodison, who recently resigned from the hospital, revealed that approximately 200 patients were discharged from the HIV clinic without the necessary ongoing mental health support. She paints a stark picture of the subsequent consequences. Several of these patients have since required acute mental health care, highlighting the severity of the situation. Many others were simply discharged back to their general practitioners, GPs, leaving them to navigate complex mental health needs without specialized support. The sheer number of patients requiring urgent intervention post-discharge speaks volumes about the inadequacy of care provided prior to their release. The lack of a comprehensive, ongoing support system for these vulnerable individuals raises serious ethical and clinical concerns. This staffing shortfall extends beyond psychiatry. The hospital has also experienced the loss of vital specialist staff in pain management and eating disorder support, further exacerbating the already precarious situation for patients facing multiple complex health needs. The cumulative effect of these staffing shortages casts a long shadow over the quality of care provided at the RPA, particularly for those already dealing with the challenges associated with living with HIV. Positive Life NSW, the leading peer-led organization representing individuals living with HIV in Australia and a partner of NSW Health, acknowledges the challenges. A spokesperson stated that while psychiatric services were integrated within the RPA Sexual Health Clinic's multidisciplinary team, temporary vacancies have necessitated referrals to the Marie Bashir Center Psychiatry Unit at RPA. This temporary solution, however, doesn't address the underlying problem, the ongoing exodus of vital specialist staff and the resulting gaps in patient care. The spokesperson's statement, while acknowledging the situation, fails to address the gravity of the consequences for patients who are left to navigate the system without adequate support. The temporary nature of the solution underscores the lack of long-term planning and investment in addressing the crisis. The concerns raised by Dr. Goodison are echoed by John Rule, Director of Research at the National Association of People with HIV Australia. He rightly points out the increased prevalence of anxiety, depression, and PTSD among people living with HIV. The loss of specialized mental health services, he emphasizes, represents a devastating blow to this already vulnerable population. He further highlights the pre-existing shortage of mental health support services, emphasizing the acute severity of the situation created by the staff departures. This pre-existing shortage, exacerbated by the current crisis, points to a systemic failure to adequately resource and support the mental health needs of this population. The sheer scale of the problem cannot be understated. The lack of adequate mental health support for HIV patients discharged from RPA goes beyond individual cases. It represents a systemic failure to provide holistic and continuous care. This failure is particularly egregious given the known increased vulnerability of this patient population to mental health issues. The lack of access to specialist support can lead to serious deteriorations in mental health, potentially leading to hospitalization or other adverse health outcomes. The urgent need for action is underscored by the ongoing arbitration between NSW Health and the Australian Salaried Medical Officers Federation, ASMFO, at the NSW Industrial Relations Commission. ASMFO is advocating for a 25% pay increase for specialist psychiatrists, arguing that this significant increase is necessary to stem the alarming rate of specialists leaving the public health system. This fight for fair compensation highlights the broader issues plaguing the public health system: understaffing, inadequate remuneration, and the resulting deterioration in patient care. The current situation at RPA serves as a stark warning, a symptom of a much larger systemic problem that requires immediate and comprehensive attention. The failure to address these issues will not only exacerbate the mental health crisis among HIV-positive individuals, but will also endanger the well-being of countless other patients relying on the public health system. The outcome of this arbitration could be a pivotal moment in determining the future of public health care in NSW and its impact on the most vulnerable members of society. The 25% pay increase requested by ASMFO is not simply a matter of salary. It is a matter of patient safety and the provision of adequate health care. The lack of action will have far-reaching consequences. The silence surrounding this issue is deafening. The urgency of the situation demands immediate and decisive action from NSW Health. A comprehensive investigation is necessary, not only to understand the circumstances surrounding the staff departures, but also to develop and implement a robust plan to prevent further harm and ensure adequate support for HIV-positive individuals and other vulnerable patients. The ongoing arbitration needs to be swiftly resolved, and the necessary funding must be allocated to attract and retain qualified specialists. The welfare of these patients should not be compromised. The future of the public health system hangs in the balance. This is not just about numbers, it's about lives. It's about ensuring that those most vulnerable receive the care they deserve. The time for decisive action is now.